My name is Dr. Jason Loth, and I'm a sports chiropractor here at Nevy Health. I've been practicing here since we opened the doors back in April of 2017. I was born and raised in Lincoln, Nebraska, and I grew up in Nebraska, and I went to a small school in Nebraska called Midland College, and then went on to chiropractic school in Davenport, Iowa at Palmer College of Chiropractic. I got into chiropractic care. I knew nothing about chiropractic up until I was in college, and I was playing baseball in college in the small town that I was in, and one of my good friends on my team there, his dad was a chiropractor in the local town that we played in. And I remember getting injured in playing baseball, and he's like, "You've got to go see my dad. He'll fix you right up, blah, blah, blah." And sure enough, I was in desperate need and went to see him, and the rest is kind of history. He changed my life. He helped me correct some things that I was doing wrong, like sleeping on my stomach on a waterbed and actually popping and manipulating my own spine multiple times a day, or having the trainers do it. And he actually helped me by adjusting the correct joints in my spine that were really fixed and locked up. And within 4 or 5 visits, I want to say, I was feeling tremendously better, and the rest is kind of history. Since then, I kind of knew that's what I wanted to do. I think chiropractic care is important because it's one of those things that many people don't have any idea on the true nature of it, first off, and then also they don't understand how powerful it really is. Like I was sharing before, my personal experience with chiropractic, it completely changed my life. And ever since then, it seems like, every week or maybe every month or something, when I have a problem or a little kid or a glitch or a little pain here and there, chiropractic for me completely takes that away. And at the end of the day, in our bodies and how they were developed, the nervous system controls everything. It controls the organs, it controls the muscles, it controls everything we do. And so chiropractic, it directly affects the nervous system by adjusting the joints of the spine, where not only from your brain, but the brainstem turns into the spinal cord, and then all of the nerves that come out via the spinal cord exiting the spine go to every area in the body, and that's in turn what affects the whole body. And that's, in my opinion, why chiropractic is one of the most important things someone can do for their overall health. I think just to kind of reiterate back on that last question, I wish they knew how powerful chiropractic as a wellness program can help their overall health. I should say can help them maintain their health. Most people, they think that health is truly the absence of the symptoms or feeling good, when that is very far from the truth. Health is actually an overall state of well-being without dysfunction, so to speak. Whereas most people, they develop these dysfunctions and problems over time, and then when they get the symptoms, they think they have a problem, when all along for most of these conditions, the problem has been developing way longer than the actual symptoms have been there. So I always use the two analogies. One is in a heart attack. Multiple times, more times than not, the first symptom of a heart attack is you actually fall over and have the heart attack and die, when there's no precluding symptoms to come before that actually happens. And then another good one is why do you take your car in to get the oil changed when it's running really well? Right? And that's prevention. It's doing it to take care of the vehicle so it doesn't create another major problem and then break down. Same thing goes for our body. So chiropractic, in that sense, for the neuromusculoskeletal system, or the nerves, the muscles, and joints, is awesome for keeping the mobility maintained within that system of the body, and then again, giving somebody that preventative health care or overall optimal health. Yeah, so my specialty is in sports chiropractic and rehabilitation in that regards. I've dealt with a lot of athletes over the years, anywhere from the Pee-wee football player all the way up to the professional athlete, the weekend warriors, and you name it kind of thing. So I love taking care of athletes. One of the things that I've seen, again, personally, but also with many of my patients over the years is I believe that chiropractic care has a huge role in injury prevention. And it has a huge role in athletic performance. And just to kind of explain that a little bit, the injury prevention side of things is when your joints and your muscles and your nervous system is functioning at its optimal, there's less likelihood for it to get hurt because it can do more of a stressor before it actually breaks down and causes that true tear or trauma and so forth. So it can help a lot with injury prevention. And then the second thing is performance. So you look at a NASCAR, for example. I mean, I'm not a big NASCAR fan, but you look at those vehicles and they overhaul those vehicles before every race, so they're functioning at their best when they go out to race. The same things with our body. So if you want to perform at your highest level, you need your joints functioning the best they can, the muscles to be as strong yet still flexible and free as they can be, and everything to be moving and functioning at its optimal. So that's what kind of inspires me. That's what I love to do, is deal with sports and performance and athletics. And that just doesn't mean just sports per se. It means any or every activity that a person's involved in. So I enjoy working with people in general to give them the best function possible, so their life can be filled with the activities they love. Yeah, I think the biggest thing that inspires me is Jesus Christ. It's He's my Lord and Savior, and this life I live for Him, kind of thing. And so my role in this life, I think, is I've been blessed with the skills that I have to do what I do, to help people like I can. And so why wouldn't I want to do that for others? And the experiences that I've had with chiropractic personally, just to be able to feel that degree of change, that inspires me to help others like I've been helped. Yeah, I think, so we'll go a little bit longer on this with what I think health is. I think health is multifaceted. Health comes from the physical side, the chemical side, the mental, the emotional, the spiritual. All of those things, in my opinion, have to be on track to have optimal health. So I like to fill the buckets, each one of those buckets, each and every day if I can. So my days start out with where I'll wake up and I'll go and read the Bible for a time frame. Get my mind right, get my spirituality right, be ready to conquer the day, so to speak. And then I'll go exercise. Exercise is super important. It gets the body moving. It helps to detoxify you. It helps all your organ systems to work. Stress relief, all that. I think that's a huge component of that. And then I'll go and get something nutritional in my body. So I'll eat healthy foods. Usually a protein shake with good essential healthy fats, raw egg, good nutrients, all that stuff in there that really help to give my body the fuel in that regards to make it work the best it can. Some good prayer time, some deep breathing, some stretching, all those things, in my opinion, have a huge impact on the overall health. And so I try to do all of that stuff in a day's time. I don't do everything all the time every day, but I pour a lot of my time and effort into that whole capacity of achieving optimal health and maintaining that optimal health. I think anyone could be a candidate for chiropractic care, but the key is to be able to evaluate that patient in a sense to determine if they're a candidate. And so my assessment is a motion assessment to go through and feel the actual functionality within the tissues. And I can say this is my youngest patient has been 1 day old. I had a mom that had a baby that she wouldn't latch on to breastfeed, and was tongue-tied, and her actual doctor referred her in to see us, and I adjusted that 1-year-old baby, and she latched on later that day. And so that was very cool to see. But I've got other stories that I've had with young kids that have had issues that have been helped by chiropractic care. Both of my daughters were adjusted at very young ages. If I remember correctly, 5 days and 9 days old kind of thing. And I would say, the oldest patient I've had has been 97 years old. So, everything's a little bit different in the kind of technique and the degree of force and the procedures that are used for that. But, I believe almost anyone could benefit from chiropractic care. For most births, the actual process, if you think about the science behind that, or I should say maybe not the geometry, but just the process of it, so to speak, where the delivery of a child that's yay big coming out of a canal that's not as big, so one of the most traumatic incidences that everyone incurs is the actual process of childbirth. Let alone the trauma on mom when it comes to that too. Not only the time frame of carrying a lot of weight, so to speak, in the front side of that child, and then also the trauma of the delivery in that. So that's only one example of the traumas that people go through day in and day out, but it's a big one, and that can have a big impact on our bodies. So That's why I usually recommend getting your child evaluated after the delivery process, just to make sure everything's functional when it comes to the spine. Something new I've been doing for my health. A couple things actually. I wouldn't say, well, the second thing is not really new, but it's something I think is very important, is getting nutritional IV therapy. I've had, I take vitamins and minerals and supplements every day, but at the end of the day, the degree of absorption of those vitamins, minerals, and nutrients is only a fraction of what we absorb through our gastrointestinal system versus how we can get it into our cells going directly into the blood. So I've been getting nutritional IVs on a preventative basis, just to keep my health upright when it comes to getting optimal stores of my vitamins and minerals. And the other thing I've been doing, which is more of a fun thing and exercise, is playing pickleball. And that's a blast and quite addicting, I must add. But yes, part of that whole concept of the whole picture of health is that exercise, and that's one way that I have recently taken to improve upon that. Oh, I'm in a totally different category and league as Dr. Penn. No, I have not yet, and I should not say that, because pickleball is one of those games that I see many of a older generation, or even male, female, that you don't want to judge a book by its cover, because there are, I did get my rear end handed to me by an older gentleman the other day, which was quite humbling, but it was awesome to see, because I'm going to be that guy someday. If I haven't had the chance to meet you, I'd love to meet you when you're here at Nevy Health. Thanks for listening to my stories. I really appreciate the open ears, and look forward to meeting you someday.
Beautiful.